Hello, my name's Hannah. I'm going to be performing my head to toe assessment skill today. First, I'm going to start by performing my hand hygiene. And I'm going to go ahead and knock on my patient's door and close the curtain. Knock, knock. Hello. Hi, my name's Hannah. I'm going to be performing a head to toe assessment on you. I'm just going to go ahead and check your wristband here. All right, checking name, medical record number, and date of birth. And I do have the right patient here. Can you tell me your full name?
Loretta Grauberger,
And can you tell me where we are right now?
San Diego,
And what year is it?
2022.
Perfect. And can you tell me who the president is?
Biden.
Perfect. Okay, so why did you come in today?
Just for an annual exam.
Okay, great. So my patient is alert and oriented ×4, and this would be the time where I would want to take a full set of vitals. I would take pulse, blood pressure, I would check the eyes, the lungs, the respirations, O2 sat, and temperature. Now I'm going to go ahead and start my head to toe exam. So first I'm going to start with your head. I'm inspecting the head, looking for any deformities, contusions, abrasions, anything that stands out like she might have an injury. So I'm just going to go ahead and palpate your head here and your scalp. Let me know if you feel any tenderness or anything like that. Do you feel any tenderness?
No.
Okay, great. So my patient doesn't have any tenderness or anything like that on her head. I'm going to inspect the face, consisting of the eyes, nose, ears, and mouth. So in the eyes, I'm looking for the conjunctiva and the sclera to be normal colored. So I'm just going to go ahead and pull your eyelids down here. All right, so those are pink and the sclera is white. I am inspecting the ears, looking for any drainage or anything that might be a sign for further injury. I don't see any. I'm palpating them. They do feel normal and intact. I am going to go ahead and palpate the whole face here. So I'm just going to feel your face here, checking for stability and some symmetry, and feeling the nose. And I'm going to go ahead and look in the nose. I don't see any drainage or anything like that. Are you able to open your mouth for me? All right, perfect. So I'm looking in the mouth, looking for any secretions or any trauma. I don't see anything of that nature. I am going to go ahead and check your pupils. First, I'll start by measuring them. So they are at a 2. So just go ahead and look right here at my nose. Perfect. And I will do the other side. Okay, keep looking at my nose. Perfect. All right, so my patient's pupils are pearl at 2 millimeters. Now I'm going to go ahead and move on to the neck. I'm looking for any tracheal deviation or anything that's not symmetric. I am also looking for any abrasions or contusions or anything like that. I don't see any. So I'm going to go ahead and palpate the back of the neck here. Let me know if you feel any pain. Did you feel any pain?
No.
Okay, and I'm also going to check the carotid pulse. All right, perfect. So my carotid pulse is strong and regular at that site. Really quick, I also am going to check the cervical nerve 7. I'm going to go ahead and have you, can you smile? And can you frown? And can you raise your eyebrows up and down? Perfect. All right, so that is working as well. Now I'm going to go ahead and check the posterior chest. So if you could just sit up for me, please. Perfect. So I'm inspecting. I'm looking for any asymmetry or anything that might show that she might have an injury. I don't see anything, so I am going to go ahead and auscultate. Go ahead and take a deep breath. Perfect. One more. Perfect. All right, so my lung sounds are clear in that field. And I'm going to go ahead and move on to the anterior chest. I'm inspecting. I'm looking for any paradoxical movement, any accessory muscle use, any bruising or anything like that. I don't see any of that. So I'm going to go ahead and palpate. I'm going to palpate the clavicle here and right right below. All right. And now I'm going to go ahead and listen to my lung sounds. At the midclavicular, go ahead and take a deep breath. Perfect. And one more. And moving on to my mid-axillary lung sounds, I'm going to have you raise your arm and take a deep breath. Good. And one more. Good. All right, so my lung sounds are clear bilaterally in all 6 fields, subscapular, midclavicular, and mid-axillary. So once I'm done with the chest, I want to move down to the heart and listen to the apical pulse. All right, so I'm just going to listen to your heart here. All right, so I don't hear any murmurs or anything like that, and it is a strong, nice sound. And once I'm done with the heart, I'm going to move on to my upper extremities. I'm checking the shoulders, the elbows, and the hands and fingers. So I'm going to go ahead and inspect all of those areas, looking for any abrasions, contusions, lacerations, or swelling, or if my patient has any pain when I am palpating. So now I'm going to go ahead and palpate, starting at the shoulders here, and moving down to the arms and the elbow. And same thing with the other one, the other arm, feeling the elbow. And I'm going to go ahead and feel my fingers here, checking the joints. All right, and I'm also going to check my radial pulses bilaterally. So my patient does have radial pulses. They are strong and regular on each side. I'm going to go ahead and have you wiggle your fingers. Perfect. And I'm going to have you squeeze my fingers. Perfect. All right, so once we're done with the upper extremities, I'm going to go ahead and move on to the spine. So if I could have you stand up for me, please. Perfect. And I'm just going to turn you this way. Great. All right, so I'm inspecting the spine, looking for any not normal curvature, maybe like kyphosis or anything like that nature, any deviation of the spine. I don't see any of that. So now I'm going to go ahead and palpate here all the way down. And once I feel that, I'm feeling for any step-offs or crepitus or anything like that. And I don't feel any of that. So now we're going to go ahead and percuss. I'm also making sure that when my patient's standing, she does have the convex curvature of the spine here, and she does. All right, so I'm going to have you take a seat. And now moving on to our lower extremities, I'm going to be checking the hips, the knees, and the ankles. So first I'm going to be inspecting, looking for any bruises or discoloration, or also feeling for any pain, and also checking for any possible edema. So first I'm going to go ahead and feel the upper legs here, and checking the knee and the lower legs. Also checking the knee. I'm looking for any edema, so now I'm going to go ahead and check. I don't see any edema. There is full recoil when I do press on the legs. I am checking the posterior tibial pulses here. And those are both strong and regular bilaterally. And I'm also checking the dorsalis pedis pulses. And those are both strong as well. I'm going to go ahead and have you push up with your feet and push down. Good. And wiggle your toes. Good. So once we've done that, I'm going to go ahead and move on to the abdomen. So I'm inspecting. I'm looking for any evisceration, pulsating masses, anything of that nature. I don't see any on first inspection here. So I'm going to go ahead and palpate the abdomen. Are you having any stomach pain?
No.
Okay, so since my patient isn't having stomach pain, we're going to go ahead and palpate all 4 quadrants. Unless she does complain of pain, we'll stop immediately. So let me know if you have any pain. All right, so upon palpation, everything does feel normal and intact. So now I'm going to go ahead and listen to my patient's bowel sounds. Starting at the right lower quadrant and working in a clockwise motion. All right, so my bowel sounds do appear to be normal active. If there was anything that I did hear, I would listen for a full 5 minutes. And now that we have done your full head to toe assessment, are you in a comfortable position?
Yes.
Okay, so my patient's in a comfortable position, so I would go ahead and document this assessment and make sure that I report any findings, and that is it. And perform hand hygiene on my way out.